Hello, and welcome to the 2021 Caregiver Support webinar series created by the California Alliance of Caregivers and the California Department of Social Services. I am Summer Rolfe, an analyst with the Foster Caregiver, the Foster Caregiver Support Unit, and I will be your facilitator today. Our webinar today is going to be about new resources for caregivers. Before we get started though, let's go ahead and talk about some of the logistics. This webinar is being recorded and it will be available at www.caregivers.org/webinars. Jen, could you please put the addresses in the chat for our viewers today? All of the handouts, the slides, and this recording will be emailed to all of the attendees after the webinar. If you would like a certificate of attendance, please email your request to info@californiacaregivers.org. It's caregivers.org as listed in the chat. And all of our attendees today will not be able to speak or be seen on video. So we would like you to put all of your questions in the Q&A. If you don't see the Q&A at the bottom of your screen, you might see the icon that has 3 dots. And if you hover over those 3 dots, you should be able to open the Q&A and type in your questions. As a foster care social worker myself for 12 years, I became close to a lot of caregivers and foster youth. And I saw firsthand the kinds of issues that families needed help with. Some of them were non-urgent issues, such as help with respite or perhaps clothing, and some of them required immediate attention, maybe dealing with the aftermath of violence, fire, or a mental health crisis. So I'm super excited to bring you this presentation today. In the Foster Caregiver Policy and Support Unit, my team hears a variety of reports from caregivers about things that are working really well and also about areas in which caregivers could benefit from more support and assistance. So today's webinar is going to be a presentation for you, the caregivers and their families, and it's going to provide a couple of individualized options for assistance through the Family Urgent Response System, or FURS, and also the Virtual Support Services Kinship Navigator, or VSS. As you hear about these programs today, you will learn which program is available to provide the support for you. We are going to begin today's presentation hearing from Jen Rexroad, the Executive Director of the California Alliance of Caregivers, and she's going to provide the caregiver perspective. Then we're going to move on to the Family Urgent Response System, or FURS, and that will be a presentation by Ricky House, an analyst, and Lori Fuller, Bureau Chief for the Permanency Policy Bureau. Then we will conclude with the Virtual Support Services Kinship Navigator, or VSS, and that is going to be presented by Whitney Robertson, who is a director at Think of Us. And without further ado, I will hand it over to Jen.
Good afternoon, everyone. Thank you so much for joining us today. I'm Jen Rexroad, the Executive Director of California Alliance of Caregivers, and we represent the voices of relative and non-relative caregivers to promote the well-being of children in foster care. So we have many programs to support caregivers both virtually through training, and through communicating and linking them to resources. Today, Linnea Blackwell, our policy assistant, is joining us as well. She's going to be helping out with the chat and reminding everyone to put their questions in the Q&A section so we can be sure to answer all of your questions at the end of each of the 2 presentations. I quickly just wanted to highlight that many foster and kinship parents advocated for the Family Urgent Response System, particularly in 2 of our Caregiver Day at the Capitol events. So we're really excited to have this amazing new service be available to our families. So we also participated and gave input from caregivers into the development of the program and the implementation. And I'm so excited about the Family Urgent Response System team's efforts to really listen to feedback and really tailor this service and kind of work out the kinks so that it is really a meaningful and robust service to help youth and families. And likewise, with our new Kinship Navigator program, we're so excited for the new resources and help connecting caregivers to what's out there, because there are some great new resources, and we just want to make sure that everyone's connected to every type of support and resource that they need to provide high quality foster care to the youth in their homes. And with that, I will pass the baton to our fabulous Family Urgent Response System team or unit, starting with Lori Fuller.
Hey, good afternoon, everyone. We're very excited to be here today to provide some information about all the specifics of the FERS program. We'll be giving some more information about how you can access it, what kind of different responses are available from our hotline, as well as at the county level. And we're just really, really excited. It went statewide in March. In July, after a partial start in March, and so far we're really happy to report that a lot of caregivers and youth have accessed it, and it's off to a great start. My name is Lori Fuller, and I am the Bureau Chief for the Permanency Policy Bureau here at California Department of Social Services, and it is the team under my bureau that is responsible for all things implementation for FERS. So again, welcome, and we're excited to give you some more information. Ricky? Ricky, we can't hear you.
All right, sorry everyone. So thank you so much, Lori. This is Ricky House from CDSS. I'm in the Placement Services and Support Unit under Lori, and our team has been responsible for the FERS implementation. So I'm excited to be here today to provide you with an overview of FERS. So Lori and I will be here to provide that overview and to field some questions towards the end. So be sure to drop in any questions you might have into the Q&A section. We're going to do our best to monitor chat if any questions accidentally get dropped into chat, but please do your best to drop it in Q&A section if possible. So the FERS Family Urgent Response Program was created, and it was designed to be built upon the continuum of care reform and provide current and former foster youth and their caregivers with immediate trauma-informed support when they need it. So FERS is intended to prevent placement disruptions and preserve the relationship between the child and youth and their caregiver. It's also designed to reduce the need for 911 call or law enforcement involvement and the needless criminalization of traumatized youth that we've seen in the past from a lack of service in the interim when law enforcement is called. FERS is also designed in mind in order to reduce hospitalization and placement into congregate care when another alternative could be there to support instead. And FERS also promotes healing for the family. So FERS has both a statewide and a local component. So the statewide component includes a 24/7, 365 days a year statewide hotline, and that response is there to respond to caregivers and youth during situations of instability. The county also provides mobile response and stabilizations through a mobile response team that's able to come out to the location of the choice of the caregiver or the youth. And that's also available 24/7, 365 days a year. So support is always there and always available. So FERS serves caregivers and also current or former foster youth. And fortunately in statute that is defined. So caregiver is defined as a person responsible for meeting the daily care needs of current and former foster youth, and is entrusted to provide a loving and supportive environment for children or youth to promote their healing from trauma. So it's a pretty broad definition. We also have a definition for current or former foster youth, which includes a child or youth adjudicated a dependent or ward of the court and who is served by a county child welfare agency or probation department. A child or youth who has exited foster care to reunification, guardianship, or adoption is also considered a current or former foster youth. So it's important to note that it covers guardianship, adoption, and any youth who has exited foster care as well, up until the age of 21. So just noting that the service is available for youth that are meeting those categories and until they are age 21. So the statewide hotline requirements. So the hotline is available 24/7 to respond to calls from a caregiver or current or former foster youth or youth during situations of instability, as we previously mentioned. Hotline workers are trained in conflict resolution and de-escalation for children and youth impacted by trauma, and we'll go over training in just a little bit. So the capacity also to provide mediation, relationship preservation for caregiver and the child or youth, and a family-centered approach and developmentally appropriate approach is very important at both the statewide hotline level and also the mobile response team level. So first, staff training standards. We wanted to just go over a little bit of what the expectation is for both the hotline staff as well as the mobile response responders. So in addition to hotline staff, the FERS mobile response responders are also expected to be trained in conflict resolution, de-escalation techniques, trauma-informed care, and have a general understanding of FERS and then child welfare and probation systems. So CDSS has proposed a number of specialty training topics, and we've spoken a lot with our stakeholders to develop lists and sort of brainstorm different training topics that are of the utmost importance. And so a list that we have here, but of course not limited to, includes overviews and trainings on commercially sexually exploited children, sexual orientation, gender identity and expression in child welfare, Native and Indigenous populations, including an overview of ICWA, sexual and reproductive wellness for youth in foster care, family dynamics, reasonable and prudent parent standards, psychotropic medications in foster care, domestic violence, and safety issues working in the community. So those, as I mentioned, are just a few of the training standards that we're really emphasizing. So what FERS is not intended to do, I feel that that's also pretty important to go over to clear up any confusion as we're rolling out a new program. And so what FERS is not intended to do is to receive or respond to allegations of child abuse or neglect. Also, FERS is not designed or intended to provide transportation or assistance in locating new placements. FERS also does not receive or respond to formal complaints about resource families or county social workers, which is important to note because the FERS hotline and also the mobile response team is designed to be a very supportive environment. And so those complaints are a completely different entity and a completely different process for investigating those, and FERS is not involved in that. So FERS also does not provide long-term therapy or other supportive services. FERS is intended to be available in situations of instability, so in moments where there is that need, but long-term services are provided by the community. So when calls are received requesting any of these services that FERS does not is not intended to provide, the CalFERS statewide hotline staff are aware of other community resources and will assist in connecting callers with 911 for situations that do require emergency services, and also connecting to the child abuse hotlines and the foster care ombudsperson's office when that's appropriate. So county mobile response teams will provide immediate in-person support and connect youth and families with their county child welfare and probation partners if they have an open case or any other community-based resources for ongoing services. I'm going to pass this off to Lori to go over the CalFIRS data and more information on that. Oops, I think Lori, you might be on mute as well.
Thank you. This is just some preliminary data that was collected prior to the program going statewide on July 1st. So just in that early period, we had about 19 counties that had their full programs in place, and the remainder of the counties had sort of an interim response because the hotline was open and receiving calls and needed to refer for mobile response when necessary. However, there were some interim plans in place, like I said. So this is just early data. And so in that early period, there was 471 total calls to the hotline, 91 referrals for mobile responses. And so what we found early on, but the data is showing us currently, about 19%, so about 1 in 5 of calls that come into the hotline result in a county level mobile response team needing to go out and meet in person. This is just a breakdown of the calls to the hotline by county. I'm not going to spend the time to go through it all because you will receive the PowerPoint and you can take a look at those. What I can tell you is that this is just sort of a snapshot of what you'll see in the future. Our data folks are in the process of preparing a more formal FIRS data reports that will be available very soon.
I was thinking that there were 3 data slides, but it looks like, oh, here we go. I'm sorry. It looks like
we skipped one. All right, so the legislation for FIRS did outline what requirements there were for data collection. And these are sort of the basics needed to be collected both at the hotline level, and some of it is the responsibility at the county level. So overall, we just need to know how many caregivers were served, separated by placement type, and then whether they're current or former foster caregivers, number of foster children and youth served, also with these different demographic breakdowns. And then what was the outcome of each call? Was there a referral to mobile response, a referral to other services? And fortunately, our statewide hotline contractor does have their own data system. So they are able to collect the majority of the information from the get-go when they receive a call. And then they are able to route all of that data to CDSS, and we are able to match it with the children in the CWS CMS database system. And that is how the actual outcome measures will be produced, and the data reports will come through that process. At the county level, when a mobile response is necessary, the county team will just need to answer a couple of questions, which is done through an automated email process, and send that to the hotline staff, and then all of that gets packaged together and sent to CDSS. So fortunately, it's a pretty easy system. And we're very hopeful that we'll get some good data on the FIRS program so that we can make improvements as we go along.
Excellent, thanks, Lori. So as I navigate to the correct slide, I do just want to acknowledge that I've seen a couple questions come in both the chat and the Q&A. So if you're able to drop in the Q&A, that's great. And we will be responding to these questions as we end the PowerPoint. So we're looking forward to going over those with you all. So getting back to the FIRS hotline, so just as some of you may know already and some of you may not yet be familiar, the Sacramento Children's Home is the contractor for the statewide hotline. So CDSS put out a request for proposal, and we reviewed several applications, and the Sacramento Children's Home was awarded the contract. And I will say I've been very pleased with Sacramento Children's Home. They've worked really well with us, and they've done some amazing work getting a program started really quickly. And I feel that they've done an excellent job of fielding these calls, as the data shows that Lori just shared. A lot of calls are being able to be worked with at the hotline. And of course, at any request for a mobile response, they're making that connection and that warm handoff. So they're able to support in the field by connecting with the county as well. So the address, the web address for them is listed right there below. And at the end of our presentation, we'll also have those lists. And I'd be happy to drop that in the chat as well. But they helped us design this logo here. They've had some great design teams. So this has really been the logo that we've been using on our flyers and some of our other outreach material that we'll be going over momentarily. So one of the first things that we created was a youth flyer and a caregiver flyer. And so we were excited to be able to develop these. We put out a request from youth themselves for any artwork that they were able to design to kind of represent FERS. And if you can see here on the FERS support flyer, there's sort of a middle graphic there at the bottom that a youth was able to design, and we incorporated into the youth flyer. So our goal was to be as diverse as possible with some of the images we chose, and also have youth-friendly language on there. So we're really emphasizing, again, that this is a free service, that it's 24/7, 365 days a year, and it's available, as I mentioned, for current and former foster youth, as well as the caregivers. So for youth, we're really emphasizing that, you know, they can call for any issue, big or small, and that they'll be connected to a trained counselor or peer to help listen to them at the hotline level, and then also at the mobile response level when possible and when requested. So FERS is a safe and judgment-free and private space to talk about any worries and vent. So if you're wanting more support, a team member can come directly to where you are and work with you on the problem and create a plan to stabilize your situation and keep you safe, are some of the messages that are included here. And the team member will follow up by helping connect you and your caregiver to local services and support. Similarly, on the caregiver flyer, we also wanted to kind of try and be as inclusive as possible with including both a female and male provider. And, you know, it's hard to include all age ranges and whatnot, but we did our best to kind of keep some of that feedback in mind as we move forward. But similar languages in the youth flyer, it's just more geared towards the caregiver audience. And we're hoping that that kind of lands home with you all. So FERS support is always available. That's a key message, again, that we're really wanting to emphasize. So 24-hour hotline support is available via phone, text, and chat. They also have email available, but it might not be quite as immediate as the phone, text, and chat options. So local mobile response services are available, and we have COVID-19 precautions in place. And the support is always personalized, and stabilization at the hotline and local levels are of the utmost importance. So we understand when there's a situation of instability occurring in the home, that response needs to be immediate, which is the goal of FERS. And so that first point of contact at the hotline level is really designed to be that supportive assistance, and then also dispatching mobile response if that's what is decided upon at your level. So it's always up to the caller to determine whether a mobile response is necessary. So that's at your discretion. If you feel that mobile response would be helpful for you in that moment, that's something that absolutely can be requested and sent your way. So again, that's the discretion of the caller, the eligible caller, either the caregiver or the youth. So also relevant aftercare support and follow-up is also included in this program, is like definitely something that's valued there. So outreach materials. So as I mentioned, the youth and caregiver flyers were the first outreach materials that we were really able to put out. And oops, I'm sorry, having trouble navigating here with all these screens up, my apologies. So with the youth and caregiver flyers, like I mentioned, they were one of the first things we were able to put out. And so they've been available for several months now in PDF format for printing and electronic distribution. So that's available on our CDSS webpage, and I'll go ahead and drop that link in the chat later as well. But we're excited to say that we are in the process of printing the youth and the caregiver flyers. We know it's very important to have those hard copy materials as well. And so those should be coming very soon. We're also excited that we've been able to translate the flyer into several different languages that I have listed here. And we also have recently gotten delivery of FERS magnets. So magnets that you can put on your refrigerator or anywhere else that would be appropriate on file cabinets or anything like that. We also received some stickers with that FERS logo. So really trying to have a couple ways of getting the message out. And we're also in the process of printing some wallet size, business card sized materials that really just have the phone number for FERS and a little bit of information there. So we're really hoping that these outreach materials will be helpful to get the word out and also just be a supportive resource in the moment if you're needing that help, to be able to pull out a wallet card and have that phone number readily available for you. So we did speak with our stakeholders and kind of get opinions from several people about the best ways to outreach for FERS. And so we're open to feedback at all times, but what we've been doing so far and what the hope is that FERS will be included, information about FERS will be included in the RFA orientation, the pre-approval trainings, in-service trainings, the biennial reviews. We're also hoping to provide information to resource family recruiters, and that can include just information in general to pass that along, but also the outreach materials that we just went over. So resource family mass emails or mailers, hopefully some of those have already went out and have been successfully able to reach you. We're hoping to send with approval certificates, share on county social media and websites, share at resource family events, complaint investigations, youth interviews, case management contacts, and child and family team meetings. So key messages, I know I've gone over a little bit of this already, but the key messages that we're really hoping come out from our outreach efforts and just from word of mouth truly is that FERS is designed to really support both caregivers and youth. And so for caregivers, the messages we're really hoping to communicate is that reaching out for help is a sign of strength. So in no way does calling FERS reflect negatively on the caregiver. In fact, we're viewing that as a strength to reach out in those times of need, because everyone has those times of need, no matter the situation. So we're really hoping that that message lands well. Also, that you're not alone and that we're here to support you. So FERS is designed to be available 24/7 if situations do arise. So FERS is designed to support placements and preserve relationships. And these services will assist in a crisis and help avoid some crisis situations. And again, FERS is meant to be a neutral party that supports both the caregivers and the youth. So we're not here to take sides, and we want to present as a neutral party and really be that. So for youth, really encouraging that support, again, is always available. That is a judgment-free, safe, and private resource that they can call for anything big or small. We want to make sure that youth are feeling heard and understood, and that they're not, again, not here to take sides, but wanting to be a neutral and supportive party. So I'm going to pass it over to Lori to go over some of the success stories that we've seen so far.
Thanks, Ricky. So as I've said, in the early data, we've already had quite a number of mobile responses and calls to the hotline, and more are coming in every day. But these are just a couple of situations that have already occurred that we thought might kind of ring true for some of you. We had one resource parent who contacted the hotline. They had placement of a teen foster youth who was placed in their home along with the teen's infant. The caller was concerned about the youth's reported mental health needs and her ability to care for her child. The hotline, listened and provided some support, and the caregiver felt that they could benefit from an in-person response. So the hotline staff called the county mobile response and stabilization team and did a warm handoff. Not sure that we really described what warm handoff was earlier, so I'm going to take a moment to do that now. The way that FERS works is when you call the hotline, you're going to hear a very short recording And it explains how by continuing to stay on the line that you're accepting, that you are providing your information and that it's okay for the hotline folks to receive and share with the county if that should happen. And by county, I mean their response teams. So that's very brief. And so just hang on the line. If you call, it will then immediately connect you to a live person. And those can be mental health professionals. They can also be parent and youth partners. And all of them have that training that Ricky described earlier. I see in the chat already that there's a question about, what's the wait time? So the wait time should be not more than, long enough to hear that couple of sentence recording at the beginning to get to the hotline staff. And in theory, all of the county mobile teams are supposed to pick up the warm handoff line for to conduct a mobile response in a very short period of time as well. As I said, all of the counties went live with their programs on July 1st. So there might be a couple of situations where they're taking just a little bit of time to get organized. And so there might be a short wait time. However, the hotline staff remains on the phone with the youth or family throughout the process until they get a county mobile response team member on the line, and then they have a three-way conversation about what's going on. So in that way, it's not just call this number and get some help. It should be clear to the mobile response team what the main issues are, what the safety concerns are, so that the mobile response can deploy immediately and get immediately out to the location and help the folks in person. So going back to the success story here, the mobile response team was able to go out and meet with the resource parent in her home. They assisted her with the arrangements for the baby to be taken to the doctor for a medical evaluation. They identified some collateral supports and services for both the resource parent and the youth. Discussed the need for some respite care as a follow-up service, and help the resource parent sort of prioritize and make a plan for addressing the youth's mental health needs. So by the end of the in-person response, the caregiver had some options, had some, time to sort of vent and just talk through some of her concerns. And in the end, that placement was maintained. Next slide. So I said some of this already. At the beginning, they were really concerned about whether this was a good placement fit, but they were able to stabilize it. And part of the first process for open cases, as Ricky mentioned earlier, is a very brief summary outlining some of the possible follow-up needs of the family will be sent to the case carrying worker or social worker or probation officer so that they are able to provide support in getting, if it's therapy that needs to be set up or that respite care, as in this case, those sorts of things. And then a follow-up also occurs from the hotline staff to the family or youth within 24 hours to ensure that all the dots sort of got connected and that they got the support that they needed. So that's was a very important element in this particular case because both the caregiver and the youth were able to get some follow-up. Next slide. And this story really kind of rang true for some of us who have been social workers or foster parents and caregivers in the past. And it's a seemingly minor incident that really just kind of escalated. So the hotline received a call from a caregiver who had an 8-year-old youth in their care who was destroying property, becoming physically violent. They had requested to have a third serving of pasta at the dinner table and were being encouraged to have a fruit or vegetable instead. And that, you know, as we know, with the trauma histories of some of these children, it can be just about anything that can escalate the situation. Fortunately, the FERS hotline staff was able to help the family. The 8-year-old youth actually got on the phone, and the mental health professional was able to listen, provide some coaching and relaxation strategies, and supported her in calming herself down. Next slide. So the outcome of that one was the youth reported just feeling much better after they sort of had someone to listen and provide them some breathing techniques that calmed down. And, you know, she started to eat the strawberries, and the caregiver felt supported rather than, you know, judged for having difficulty in managing what kind of might be seen as an everyday parenting situation. We all know that, you know, the dinner table, homework, bedtime, some of those things can really, really be challenging. And so in a period of about 20 minutes, child was calm, eating strawberries, and their evening was back on track.
We have one more success story here to share before we jump into Q&A, so I'll pass this off to Lori for this.
All right. In this situation, a caregiver contacted FERS because the 15-year-old that was placed ran away, and they wanted to give notice and have the youth moved from the home. A mobile response team arrived and took the youth out of the home for a few hours to give both of them some calming space, some time to sort of calm down and release some of that tension. They also engaged a peer partner for additional help during the response. And once everybody had a timeout, a little chill period with those professionals, the caregiver withdrew her notice and agreed to reach out if she needed help again in the future. And the placement was supported and maintained.
Excellent. So as I mentioned, we'll just go over some of these extra web page addresses, and I'll drop these in the chat here in a moment as well. So the CalFERS web page is an excellent resource and is the landing page for the statewide hotline. So definitely feel free to check that out. There's the chat option on there as well, but just some great resources. If there's ever questions at the state level, not really the statewide hotline level, but at the implementation level, you can reach us at fers@dss.ca.gov. And then CDSS has also had a web page up and going as we went through the implementation process for several resources. And so there's some resources on there that can be really helpful, including scenarios. So there's a resource on there that kind of outlines different scenarios to help people get an idea of, you know, when to call FERS, like just some example scenarios of when FERS has been contacted. But the main message that we really want to send to both the youth and to the caregivers is that FERS is a supportive resource that can be contacted really for any reason. So even if there's a question about whether to call FERS, if you're able to call FERS and speak with someone at the hotline, they can really help you sort of determine next steps. So feel free to always give a call to the hotline. So we're going to move along to questions and answers, and we'll do our best to kind of catch everything that's in the chat and the Q&A section. If we miss something, feel free to drop it in there again, but we'll just move on to that. So I know that Lori and I were kind of chiming in on a couple of these questions. We had a few questions about county specifics. So a couple of people have asked whether, you know, a certain county has a FERS program. And so yes, every county in the state of California is required to have a FERS mobile response program. So they're supposed to have a mobile response team that's able to accept the call from the statewide hotline. Lori previously went over what a warm handoff is from the hotline. being able to transition over to the mobile response team to share that information and have that mobile response team be able to respond. So yes, every county is required to have one. And as Lori mentioned, in the earlier implementation, we're still working with supporting counties to make sure that transition is smooth. But yes, counties do have that. So let's see here. I know that Lori had jumped in on a couple questions already. One question I see here about training. So are the trainings being offered through CDSS and accessible, or are these suggested trainings that we had went over?
So we did provide a FERS overview training. It's a recorded training that is on our website. And so that is thus far what CDSS has produced in the way of training. The counties are able to determine what resources they would like to use, and they did, all of the counties did get an allocation for their FERS programs. And so they can determine what trainings they want to use, how they want to actually provide that training to the staff. It's up to them. And as long as they are covering the required elements within the statute, they have some decision-making power on that. We are in the process of requesting some additional funding so that we can develop more CDSS training curriculum. So we'll see where that goes. We're hoping that we're going to be able to provide more specific curriculum that will be available to staff as well as caregivers and youth in the future. One other question I did say, kind of respond to a little bit about what is the average response time. It might be important to also note that the requirement for the county mobile teams is to get out to the home within an hour, hopefully, but definitely no longer than 3 hours. That time frame can be adjusted if the caller requests a specific time that's outside of the 1 to 3 hour time frame. So if they would prefer to have someone come out when all the family members are arriving home at 6 o'clock, that can be arranged for. But other than that, the requirement is 1 to 3 hours for them to actually go out to the home or whatever location the caregiver or youth is at and has agreed upon to receive their mobile response team.
Correct. And so, yeah, thanks, Lori. The question about what is the average wait time to get a hold of someone when calling, I know Lori went over that earlier. And as she mentioned, when you're calling the statewide hotline, there are a couple of pre-recorded sentences that are included just to let you know what FERS is and go over some of the confidentiality requirements and any other things that need to be heard before proceeding with the call. So after those couple sentences, you should be connected with a statewide hotline representative right away. So the next question on here, a great question. It's how many personnel are included in the deployment of a mobile response team?
That's a great question, and that's going to vary depending on the situation. So during that warm handoff process, the statewide hotline staff with the family on the line is going to describe the nature of the incident and what's going on. And then the county team members will determine who should be sent out depending on the need. So if you've got a youth calling and they really want to talk, to someone with lived experience similar to them, the youth partner, former foster youth usually might be sent out, probably along with a mental health professional. Also, if it's a caregiver that really, would benefit from someone who has had similar experiences providing care to children in foster care, the parent partner might be the appropriate responder. So the mobile, county mobile folks will determine who to send out depending on the nature of the incident.
Correct. And, this can vary based on the county as well. But just to kind of give you an idea, so at minimum, it would be 2 people. So the goal is always to make sure that someone is able to meet with the caregiver and also meet with the youth in case, we're needing a moment away from each other. So there's always going to be at least 2 people responding, and Lori's absolutely correct in, the mobile response team is going to determine, the most appropriate people to go out. So there's another question here about what steps does the program have in place in case the de-escalation process isn't successful?
So that's a good question. If the hotline receives a call and they are mental health professionals and they will be determining, the urgency in terms of, is this a crisis that would be requiring a 911 response or a call to law enforcement or a higher level crisis team, they will assist the caller in the moment in making those connections. Now, if there's a situation where, yes, the crisis team, there's maybe some suicidal ideation going on of a serious nature, and so someone needs to be deployed to help with that. That doesn't mean that a mobile response from FERS might also go out to support the caregiver, but of course, if it rises to that level of need, first responders will be deployed to ensure that everybody's safe. Ricky, can you remind me of the rest of the question?
I think that covered it. So what steps does the program have in place in case de-escalation process isn't successful?
And the other thing that is a part of FERS is connection to if it's an open case, to the CFT teams. And actually, sometimes even if it's not, the CFT team at the county might get involved shortly after a response to help with kind of those next steps in either supporting the placement or determining an alternate if it's really not a safe situation for somebody.
Right. So another question we have here is, how can we get stickers or magnets, which is a great and timely question as we're just getting those in. They were literally just delivered this week to our main office. So Lori, I don't know if you want to take that or if we're still determining that.
We did provide some guidance to counties about obtaining those resources, but if you are an agency or interested in getting a number of those supplies to provide at your offices, that sort of thing, you can email the fers@dss.ca.gov email box, give us your information and an approximate number of stickers or magnets that you would like to receive. We are putting a maximum of 500 on that, just so that everybody can get some in our first production of those materials. So feel free to email that box, and if for some reason we're not able to assist at the moment, we'll let you know and give you some time frames on when we can do that. Summer, I'm wondering if we are about at time.
You are.
Okay. So if there's other questions that we didn't get to, again, that email box is available for additional questions. We will also try and look through and when you're provided the other materials, if there's a way that we can provide a written response, we'll do that.
Yeah, and I'm seeing the two questions I'll just touch on really quickly is FERS available for FFA resource parents, and then also is service for resource parents only or also for STRTP placements. So yeah,
it's for all of the above.
Correct. Yeah.
Thank you very much, Lori and Ricky, for a great presentation. And again, more information is available if people want to check out your website or look at the flyers. The flyers will be sent out with this presentation and the slides. So there are a lot of other ways that they can get a hold of you for more information. And now I would like to present Whitney Robertson with Think of Us.
Thank you, Summer. Hi, everyone. My name is Whitney Robertson. I'm a director of programs here at Think of Us, and I'm accompanied with my colleague, Crystal Blue, who is the California's senior manager. And she's going to watch in the chat for any questions that may come up so that we're making sure that we field those at the end of the presentation. And she's also going to provide our virtual support services website in the chat. All right. So here at Think of Us, our mission is to drive change for caregivers and youth in order to heal, develop, and thrive. And so who are we? We center lived experience and leverage the best of technology and practices from within and beyond child welfare in order to spark, support, and drive change. We are like a research and development lab. We find and test what works best and iterate based on what we're finding caregivers and young people need. And so in that, we're able to develop solutions that provide immediate support to not only current and former foster youth, but also to those in their lives, including kinship families, foster families, caseworkers, and beyond. One of the differentiating facts about Think of Us is we center lived experience. And so the majority of our staff have lived experience either as current or past kinship caregivers, foster parents, may have been in the foster care system, or they're proximate to the child welfare system. And so we believe that by doing this, center and lived experience is the way to solve some of the biggest problems with the system and operate in a way that assists caregivers and young people. So our challenge in California is accessing resources and services have proven to be difficult. And sometimes the resources and services don't exist. And so where we see our opportunity as the Kinship Navigator program is being able to provide caregivers and young people with that resource navigation. So we do outreach to kinship caregivers across the state of California and young people who are in care or aged out of care or were former foster care youth to understand the needs. We want to hear from the caregivers themselves, the young people themselves, to really understand what's working and what's not working so that we're able to design and continue updating our virtual support services in a way that's going to meet the needs of you as caregivers or young people. We connect California kinship caregivers and young people to resources and services that meet their needs and provide access to community responders, which I'll get into a little bit later, who have proximity or lived experience to the system. So like I was saying earlier, when I'm talking about proximity or lived experience, it means that the individual actually has been through the foster care system or was or is a current kin caregiver, resource parent, foster parent. We also are developing access to non-traditional resources. And so what we're doing and have been doing for the past several months is identifying gaps in resources and services across the state of California that kin caregivers and current and former foster youth are experiencing. And by identifying these gaps, we're able to spark, support, and drive new solutions, typically in the technology space, but to reduce the complexities to access these resources that promotes healing, developing, and thriving. And leveraging this moment and this opportunity as the Kinship Navigator program to change how access to resources exists. And so we partnered with the state of California, CDSS, to bring virtual support services, which is the Kinship Navigator program, with the goal of providing reliable, streamlined access to the information and resources that caregivers and young people need to support themselves. We've heard loud and clear from communities how challenging finding the help you need when you need it can be, especially during this pandemic. Many of our staff, like I said, have lived experience in foster care or as kinship caregivers, and we're here to help and support through every challenge, obstacle, and victory. And so to get a little bit more into our virtual support services and what it is, it comes down to three big buckets. And so in order to provide holistic targeted resources and navigation support, we've got the digital collaborative, which I'll go into detail in a little bit, but bringing together leading tech-enabled solutions to access resources in housing, education, employment, mental health, basic needs, and more. And so those are going to be those non-traditional resources where we're filling the gap. Maybe they don't exist locally or just in the traditional setting. We also, another bucket is our virtual community navigators. So those with lived experience or who have proximity to the system staff the virtual support services program to provide tactical and navigational support and ensure that California caregivers and youth are able to access the services that they need. So it's not just providing a list of, different resources or services. It's really getting in there and doing the tricky and tedious jobs of filling out applications, doing the research, us doing the vetting, so that we take off that load for the caregivers and young people, especially since we know a lot of times they already have so much going on or maybe in crisis that it's hard to access services during those moments. And then the third bucket's our digital resource library, which I'll show during our demo a little bit later. But this is self-paced, bite-sized resources designed to give caregivers and foster youth alumni immediate access to support. And so our virtual support services allows us to provide connection to services, coaching support, and asynchronous resources on inspiration to show what is possible. So thinking outside of the box with the non-traditional resources in the digital collaborative, healing to recover from and manage trauma, development to build the skills to learn, grow, and thrive, navigation to access resources and supports available, and advocacy. And so what is the solution? And how does it work? And Crystal's going to drop our virtual support services link down in the chat below. But here we've got caregivers and young people are able to access and navigate virtual support services via a website where they can request direct support from a community responder who can respond via their preferred method. So we're able to email, text, video, or call with caregivers and young people to make sure that they are getting that access and navigation support to resources. There's also the option to navigate on your own with personalized resources being recommended. And I'll show that a little bit later in the demo as well. And then of course can access the non-traditional resources within our digital collaborative. And so what is this weird thing that I keep talking about called the digital collaborative? And again, when I'm saying non-traditional resources, I'm referring to the digital collaborative. So what will the digital collaborative do? So the digital collaborative consists of proven tech nonprofits that provide tech-enabled interventions outside of the child welfare system so that child welfare agencies are able to prioritize and focus on building relationships with youth in their care. And so really, it's these non-traditional resources that individuals are able to access from their home and not having to go through any type of barriers, with transportation or childcare to access, maybe like mental health services. This is just that thinking outside the box and bringing that access directly to kin caregivers and youth. And it's tailored to kin caregivers and transition age foster youth. What does that mean? we've done a lot of testing and piloting with different digital collaborative partners. And so by testing and piloting it with caregivers in California and with young people in California, we're able to get that feedback loop on what's working and what's not. And then we at Think of Us are able to meet with our partners and say, hey, this is what's working, this is what needs to be tweaked to make sure that you're really meeting the needs of caregivers and transition age foster youth. And so just some of them that are part of it is the National Center for Housing and Child Welfare. And so what they do is they assist with what's called a Fostering Youth to Independence housing voucher that a lot of individuals may not be aware, and caregivers may not be aware that the young people may be eligible for. College readiness coaching, we do get referrals from caregivers who are trying to assist, maybe their grandson, granddaughter, whoever that they're caring for, get ready for college. They may not have experience or know where to turn. And so this is one of our partners, Beyond 12, that assists with that. We have a digital locker with Box, mental health coaching with MindRight. And so like I was saying earlier, accessing healing and trauma-informed care doesn't have to always be through the traditional route and may not be the preferred route, or there may be barriers to accessing that. And so MindRight is one of our partners who provides mental health coaching via text message for 2 hours a day to young people. And then basic needs is we've partnered with One Simple Wish, and One Simple Wish has been really awesome. We've had a lot of caregivers and caregivers across the state of California in need of basic needs or a laptop to assist with, their young person's getting ready to go to college, clothing, getting ready to go back to school. And so we partnered with One Simple Wish to be able to put in those referrals for the needs and get them funded. And then financial coaching, we partner with Community Financial Resources. And so an example of this is another one of our partners with MRelief. And so what MRelief does is it helps individuals apply and qualify for food stamps. And it gives you two different routes. You can do it all via text message, which you do the eligibility and find out within like 3 to 5 minutes if you're eligible for SNAP benefits or food stamps. Or you can do it through their website, which again is super simple, 3 to 5 minutes. And so instead of having to go to, figure out if you've got to have childcare and transportation and probably sit a while to figure out if you're eligible for food stamps, this is just one of those non-traditional resources that you can access through our website, or a community responder can assist you walking through the steps and applying. And so what are the community responders? Community responders are tasked to connect caregivers and young people with resources and services, support caregivers and youth in identifying, communicating, advocating for, and meeting their needs, and making sure that they're organized and resourceful and researching opportunities. And so what does this role require? Lived experience as a kinship caregiver, former foster youth, or someone who is proximate to the child welfare system. Experience in trauma-informed care and healing-centered practices. Bilingual in English and Spanish. So all of our community responders are bilingual. Experience working with caregivers and youth. And of course, experience navigating complex systems. Some of the skills and competencies that are important to note is awareness of and competence in racial, cultural, disability, class, gender, and LGBTQIA+ justice and equity, effective communication skills, especially in the virtual world, trauma-informed and active listening. So I wanted to highlight just a couple of quotes that have come from California who have engaged with our community responders. And so one of them was from a caregiver who said, "Thank you for thinking of us caregivers." Another one came from a former foster youth who we referred to one of our digital collaborative partners, One Simple Wish. Big thanks to think of us, I swear. And he was able to obtain his basic needs via that referral. And then one came from our one of our digital collaborative partners, Box, where we partnered to have a global impact day. We heard a lot from caregivers across the state and young people that being prepared for a job, developing a resume, editing a resume, interviewing skills, developing a LinkedIn was a need. And so we partnered with Box on that. And so a Box employee said, "Fun story. One of the youth that attended the Box and Think of Us Global Impact Day is now part of our Box Advisory Council." And she shared with me that she was able to secure a job 1 week after practicing interviews with Boxers during Global Impact Day. I'm going to do a demo now. I know it's a lot of information and much easier if I show you what I'm talking about. So our virtual support services website is getvirtualsupport.org. And you can come here anyone can come here to access this. But on the front, we try to keep it really simple. Up here at the top, if you need it in Spanish, you're able to change it over to Spanish. And so here you can click through each of the items to identify like what our community responders and resources are going to be provided or give you access to. So if I went through food, SNAP benefits, WIC benefits, groceries and meals, type of housing, emergency housing, we've seen a lot of incoming requests for emergency housing funding, financial, one-time financial assistance. And so we're able to navigate to that, housing vouchers, education and employment. Again, this can be from the perspective of a caregiver, or it could be a young person, or it could be the caregiver needing assistance and access to services or resources for a young person that they are caring for. But education and employment, advocating for yourself and your family, so guardianship, adoption, becoming a resource parent, legal support, understanding your rights, school advocacy, finances, and health. And on health, of course, we've got mental health support, peer support groups, physical health. We've even had like dental health come up recently, and accessing resources or providers that they're eligible to receive those services from. So what happens when you request support? We listen with a bit of information from you, and it's pretty quick, nothing that you have to spend a lot of time providing us information with, which I'll show you. We're able to match by your needs individuals to resources in your community and online. And we follow up. And so, as the Kinship Navigator program, we want you to consider us as your personal assistant. So this means we'll fill out applications, cold call providers, and follow up until you've got the resources that you need. And throughout the website, you'll see these call to actions where you can click throughout. I'm going to keep navigating the site just to show you what's here. Do you have anything we can support you with? So you're able to click, how can we support you? And yes, and it's going to take you to the same place. Or you're able to browse resources on your own as well. And so I will show you the two different ways. So on how can we help you? If I wanted to browse resources on my own, I can click here and say I'm a King caregiver. For some reason, 90210 is the only zip code I typically remember off the top of my head from my parents watching that show. And say we're looking for mental health. You press search. My internet, hopefully, yep. And so in this, it's a little bit different than if you were to go to Google per se. and search, because it's going to have some vetted resources initially. And so mental health support groups, one of the digital collaborative partners that we are partnering with is PACE. And so PACE provides caregivers, current foster youth, past foster youth, with a virtual support group that is over a course of 12 weeks. And so this is one of those non-traditional resources that we've partnered to provide California. Other mental health services will be pulled and provided. So if you wanted to, go through this based on your location and based on the need, main services, you can do that independently. If we're to go back to how would you like to get support? So we just looked at browsing resources on your own. If I want to say, hey, I want a community responder to help me, you can click call, email, or text. And let's say we were to do, let's say text. And so you just fill out this short form, and I will fill it out just to show you what happens at the end. It can actually detect your location as well. I'm just going to stick with 90210. So let's say I'll just give away my age. I was going to pretend to be younger, but it's okay. I'm a kin caregiver. I'm 32. And there is a reason that we're asking these specific questions, because when you provide this information, it's not going to show you resources that you're not eligible for. So you don't have to like go through it and figure out, oh, well, I'm 25 and it only goes, or I'm 32 and it only goes up to 25 years old. I wouldn't be eligible. We want to make it easy and quick. So can caregiver, let's say I need mental health support and I need a job. Let's say I need help with resume review. And here you can put anything else we should know. Let's say I am caring for my 13-year-old niece, and we need mental health services. And so I press send. And so it's perfect. We've got your request, Whitney. One of our community navigators will text you, because I did put text, within 24 to 72 hours to follow up on your request, so employment, mental health. And what happens is it goes directly to our community responder team, who is tasked with the 24-hour turnaround time, business days, and they will respond. Because I said text, you would receive a text message directly to your phone, connecting with them. And that is it on the demo. You're able to do the same thing with email. You're also able to call, request a call. And what it does is it links to the community responders' calendars, and you're able to identify a 15-minute, 30-minute window to be able to call. And I'm going to go back here really quick and just show this slide before we get into Q&A. This is my direct contact information. If you want to email virtual services, if you've got a question, of course, you can reach out to me. We also have a virtual services email address. And then again, getvirtualsupport.org is our website. And I'm going to stop sharing. So I know we've probably got some questions.
We do. Thank you for that, Whitney. So Delilah asks, is this service only for resource parents or also for short-term residential therapeutic program, STRTP?
So anyone can access it. So if it's a resource parent accessing it, that works. I guess I would want to know a little bit more about the context for the short-term residential placement. They can access it, they can navigate it. It just may not show specific resources, such as like the non-traditional digital collaborative, they wouldn't be able to utilize that per se, unless it's for the young person or for the caregiver. I hope I answered that.
Okay. Is there any support? So this one came from Danielle. Is there any support with helping the child in our homes to receive the pest assistance? I have a situation where the cards were sent out 11/20/20, but the children were here. The cards went somewhere else.
I definitely want to be able to answer. I'm not sure what we mean by cards. But there's what I would suggest is going ahead. Oh, EBT, yes, that's something that we could assist with. If you come through go through our website, happy to assist. I would just recommend going through the community responder, going ahead and requesting a community responder to help navigate with that, and we can assist with that.
Great. Thank you, Danielle, for clarifying that. Housing, what services do you mean? And that came from Donna.
So it's a range. It can be, financial assistance where we're actually doing like the research of local programs or providers that provide it, and we can do the three-way calling. We can help apply. There's a lot of like COVID-19 financial assistance that I've seen come in where we're able to help the individual apply for that type of assistance. There's also, there's been situations where we've had individuals who are homeless, and so being able to connect them with programs and immediate, housing, but also long-term housing as well. Like if we had someone who is eligible for like the Foster and Youth to Independence voucher, which is 3 years paid a voucher for specifically for foster youth who are at risk of homelessness or are homeless. Those type of housing vouchers we're able to assist with. If a caregiver says, hey, I just took in 4 of my family members, I need a bigger house, can you assist me with like next steps? We're able to assist, navigating that as well.
Okay, great. We have a question from Jolene Aguilar. Does Think of Us serve those who are probate guardians or informal relative caregivers, since so many caregivers are providing hit and foster, that they do not have a lot of resources?
I love that question. Absolutely, yes. One of our goals is really to be able to outreach to hidden foster care. So those informal caregivers who don't know about different resources or may not be eligible for. So yes.
Great. We have a question from Jessica. For health-related resources, is it going to tell you if a resource is only available for individuals with a certain type of insurance, such as Medi-Cal versus a private plan versus uninsured?
So typically, yes. And if you're navigating on your own, it will show that. But I would almost suggest going ahead and connecting with a community responder, because you'll be able to provide them with that direct information of, I have this type of insurance and this is the service I need, so that they're able to do the work for you. And you don't have to spend the time going through and figuring out, do they accept my insurance? Do they not? That's something that we take off of your hands.
And those are all the questions so far.
Awesome. One thing I would say, that differentiates to where we would probably refer to like the FIRST program and partner with them. We're not a crisis center. And so, with being in crisis and needing resources, we're able to assist that connection. But if you're in a true like right now need and it's a crisis, then we're going to do referrals out to those who are able to provide that crisis response. And if no other questions, I will pass it back to Summer.
Thank you, Whitney and Crystal, for another great presentation. You are providing incredible services to the families and the caregivers, and I know that those, especially the relative caregivers that are informal or participating in hidden foster care, especially, are probably pretty excited to hear about the services and the personal assistance and the hand-holding that's available to help them get resources. So thank you so much for that presentation. I would like to thank everyone for joining us today. And please keep your eyes out for our next presentation next month. It's going to be a caregiver and SOGI youth panel discussing suicide prevention awareness. I would like to thank the FERS team and the VSS team from Think of Us for presenting information today. You will be receiving a copy of this presentation as well as everyone's slides. And again, if you need a certificate of attendance for today, please reach out to the email that was provided in the chat today by the California Alliance of Caregivers. And thank you very much, and we hope to see you next time.
Bye. Thank you.
Bye-bye.